Hi, I'm Dr. NGYN and I have a clinic in Portland, Oregon. A feature of laser vaginal rejuvenation is correction of stress urinary incontinence. On my diagram, I point out that under the urethra, a surgeon has to be aware of urethral support as a way to stabilize the bladder. The urethral support can be created with a device that we insert into the vagina at the time of laser vaginal rejuvenation, or simply with stitches, with sutures, where we actually pull the tissue, the fascial tissue under the urethra to create support so the urethra won't move when a woman coughs, sneezes, or laughs. I want to talk about stress incontinence for just a moment because it is so common. Stress incontinence is the loss of urine uncontrollably when a woman jumps, coughs, laughs, sneezes, or there's any sort of increase in abdominal pressure. A little bit of stress incontinence is normal for women, particularly when the bladder is very full. But if it gets to a point where she has to wear a pad every day for protection, or is leaking and embarrassing herself, or having accidents through clothes. I also have patients that are afraid to travel and get on an airplane or stay in somebody else's home because they might ruin the mattress. That's getting to a point where you should think about surgical correction. Before we do surgery, there are conservative things we can do, which include Kegel exercises, physical therapy, weight loss, quitting smoking. But if these other measures don't help, surgery is extremely successful in helping women correct that problem. As part of the consultation for vaginal rejuvenation, we do talk about the bladder since it is so close to the vaginal tissue. And the vaginal laxity is created by the bladder dropping into the vagina. So as part of LVR, with the laser, we open the vaginal tissue, support the tissue around the bladder to elevate it, and pay close attention to the urethra so that it no longer has the ability to move during these things that women do that cause leakage. I'm really excited to be able to offer women a solution, a minimally invasive solution to help them stop leaking. As part of improving their sexuality, I'm also helping to improve their self-esteem, their hygiene, and their activity levels because they can go out and run without having to wear a pad or walk or do whatever exercise they like, and they just feel better about themselves.